found your therapist online, you had the consultation, and this therapist sounds like this therapist is a good match for you. So you made the appointment for first session. And now you're like, what am I going to expect? Well, that's what I'm going to cover today. Hello and welcome. I'm Carol Cavelli, a licensed therapist, and I support the emotional health and wellness of women in midlife. And this is part 4 of a 4-part series about how to find and connect with and match up with the therapist that's right for you. And in this video, I'm going to cover the first session and what to expect. Let's get started. The first thing I want to address is before you even go to this first session, if you're in the United States and you're using insurance, you definitely want to make sure that your insurance plan, everything is squared away in terms of what your coverage is, if you need any kind of referral, any kind of pre-authorization, and if you are using out-of-network benefits, what those benefits are, because you don't want to be surprised weeks down the road when you receive a bill, or if you don't receive the reimbursement you think you're going to get, or you find out that the therapist is not in network. So you don't want any surprises. So that I would say is first and foremost, as before you go into that first session, make sure everything is in its place with your insurance. Now that everything is in place with your insurance and payment methods and everything like that, let's talk about what the first session is. So the first session is known clinically as an intake session, although I refer to it as an initial session, and a therapist may refer to it as something different. But clinical-wise, it's called an intake. And sometimes it lasts 1 session, or it can last up to 2 sessions. And the goal of the intake session is for the therapist to find out all this information about you, find out about your history, find out about the problem or the issue that you're bringing into therapy, and to start parceling down, so learning this broad information and start to parcel down how they can help you, and eventually to identify what a treatment plan would be. So a treatment plan is a clinical term, is the formal plan on what your treatment is, what the goals are, and what the objectives are. So the goal is the overall outcome you want to have for therapy, why you're coming to therapy to begin with. And the objectives are the steps to get you to the goal. So the goal is the overall, and the objectives are the steps. And a therapist will have a formal document in your chart, particularly if they're working with insurance. They have to keep a formal documentation in your chart of your treatment plan, and always refer the treatment to the treatment plan. Now, the treatment plan can change because goals can be satisfied or goals can change, but that is the document that sets forth what the outline or the framework for the therapy is. So that's one of the things that therapists are looking to do. They're looking to find out this information about you. They're looking to, as they're finding out information, they're thinking about how they can help you, and how they can, if they have to, refer you to any kind of adjunct professionals or anything like that. Or they may be thinking, wow, okay, this is not a situation I'm skilled at. This is not in what's called my scope of practice, right? So therapists have what's called their scope of practice. They have their training, and they have like their kind of boundary as to where they're most proficient in working with. So for instance, I work with adults. So if someone comes in and I'm thinking, okay, they want to work with me, but they're saying, well, I really want you to work with my 10-year-old, she's having so many issues. And I feel for that situation, but I have not worked with children or adolescents. So children or adolescents would be out of my scope of practice. I don't have any experience, or I don't know the ins and outs of what I would need to know legally to work with a child or an adolescent, anyone under 18. So I would not be the proper fit. But if I'm meeting with this person, I'm then thinking, well, who can I refer this person to? Who can work with a 10-year-old with these problems? And then I would say, well, this is not my scope of practice, but I'm happy to help you in this session, find out what's going on, and to refer you to someone who can help. So therapists are always assessing in those first couple of sessions. They want to make sure that they're the right fit for you. They want to make sure that they understand what the information that you're giving them at that time. Now, obviously, in two sessions, they're not going to learn, and you're not going to want to tell them every nuance of your life, but they want to know as much information as possible about you, so they can start, again, formulating that treatment plan with you. That's something that you do together collaboratively. That's not something a therapist goes off on their own and just formulates what they think their goals should be for you. You say, this is what I want, this is the outcome that I want, and then you discuss how that treatment plan, what that would look like. And therapists also want to convey certain information to you. So under law, therapists are obligated to communicate about confidentiality, when confidentiality is held, and when confidentiality is broken. So the therapist will communicate under the circumstances that confidentiality can be broken, and when you're not under those circumstances, when confidentiality would be held up, when disclosing information, what is needed, what has to be on file, like an authorization or something like that, or any kind of communication with another provider or family member or someone like that has to be authorized. And they want to answer your questions about therapy, about them, about their training, and to start collaborating, or to start identifying what your goals are for therapy. What do you want by coming to see this therapist? What do you want to see happen? And then from there, identifying a plan or a course of what treatment could look like, with an overall goals and objectives, steps to get there. So that's what the therapist has in mind. Again, they're getting that large breadth of information, and they're funneling down to where you want to be, what you want from this working relationship. They will also inform you that you do not have an obligation to continue with therapy. That's right. Just because you're in the space with the therapist, whether it's a room that you're in or in an online space, doesn't mean that's the person you're stuck with. You can absolutely go for that initial session or go for that intake session and realize, this person isn't for me. You're there, for whatever reason. You don't like the vibe, whatever, it's fine. You have that choice. You don't have to work with that therapist. To wrap up what a therapist has in mind in a first session, the idea is to communicate to you what their obligations are under law, what their limitations are under law in terms of confidentiality. They also want to inform you of how they work. They want to listen to your situation. They're going to ask you a whole lot of questions about your history. They want to get to know you more. This is when we start, as they say, kind of digging in to learn about you, to learn like how they can help you, to learn about what's in your history. And they're also assessing if they are still the right match for you, or if there's another therapist or an additional provider that they can refer you to. And going forward, you can end therapy at any time. So if you inform a therapist you just want to discontinue treatment, oftentimes a therapist will encourage a final session as a termination session, as a way to wrap up the work, or to find out if there's anything else that you need in terms of a referral or any kind of additional support that the therapist can refer you to, or even a referral to a follow-up therapist. Therapists say, okay, I understand that. What are you looking for? Maybe I know someone who can help you, and then if you give me permission, written permission, I can speak to that person. And that's clearly up to you. You don't have to take a therapist up on a referral if you don't want to. But typically that's what's offered. And you don't have to do the termination session if you don't want to, but it's really about closing off that relationship if a relationship has started. So if you've seen a therapist for a little bit, there's always that offer to kind of tie up that loose end. Now, let's look at, as a client, what you want to keep in mind when you go into that first session. Now, as a client, anything can happen. So what I mean is, you may walk into that therapist's office or think, I'm going to walk in that therapist's office and I'm going to tell them this and this and this and this. And that can absolutely happen. Sometimes it goes in a different direction. Sometimes you might feel overwhelmed with emotion where you come into that therapist's office and you cry, or you're upset, or you're sad, or you're venting frustration. Like, sometimes those emotions that have been bubbling under the surface, when you have that moment to either sit on that couch or just be on that screen and have that person who's going to listen to you, it can open up a lot of emotions and a lot of thoughts and feelings. And that's okay. Therapists are prepared for that. It's happened multiple times, many times over the years with me, and therapists are prepared for that. So it's okay if you're feeling emotional when you go in. One of the things you want to find out during your time with this therapist is if they are still the good match that you thought they were from the consultation. So you'll be learning a little bit more about them. You can ask them about their training more. You can ask them about their approach. So the therapist is going to ask you a whole lot of questions about you, and you're going to give a whole lot of information about you. And then as you get closer to the end of the session, again, sometimes intake sessions can go more than one session. So sometimes a first session might feel a little like, things aren't wrapped up here. But you can get to a place where it's like, well, what are your initial impressions? What are you thinking? And the therapist could give their initial impressions, who could say, well, I really want to learn a little bit more information about you, but what are your thoughts? What are you thinking? And you could start that collaboration process in that first session. So you want to get a sense, is this therapist collaborative? Is this therapist skilled? Is this therapist answering my questions and not maybe feeling defensive? If you start asking about skills, are they getting defensive? Or they're like, yeah, I'll tell you all about my skills. I'll tell you all about my training. What do you want to know? You want to know if you feel like you're building a rapport with this person. And some of that is, you can tell by things that they say, and some of it is a little intuitive. Again, vibes, for lack of a better word, kind of get your sense of, okay, is this person really the right person for me? And there are a couple of things to keep in mind with therapy. So the first is, and I said this before, you can stop therapy at any time. You can go to that intake session and realize this is not the right person for me, or realize this is not the right time for therapy for me. You don't have to, you're not obligated. And if you start with a therapist, again, you're not stuck with that person. If you feel like it's not working out for you, you can find another therapist, or you can let that therapist know this isn't working out, and you can try and see if you can salvage it if you feel like it's just that they're not on the same page with you, and you just want to be able to get them on the same page. Or if you feel like this person is just not in the same ballpark as you, then you can say this really isn't working out. And if you do that through something like email or messaging or something like that, a therapist will typically offer or encourage a final session, which is a termination session. That's if you have an established relationship. Obviously, if you just go to the first session and you realize, this isn't right for me, or this is not the right time, or I just don't want to do this, therapist's going to say, okay, well, let's have a termination session. No, if you have an established relationship with a therapist, they will offer a termination session to just kind of wrap up and go over things and see if there's anything else you need from them. Do you need a referral, or do you need any kind of other information that say that you want that therapist to communicate with your next therapist? You can sign an authorization for them to do that. Anything like that. So that is greatly encouraged, and it does help relationally, in a relationship, in a working relationship, to tie off that loose end, to have that definitive ending. And then for this last part, to keep in mind, I'm going to read a little bit off my list because there's like several things here I want to cover. So know overall that the therapist is not going to have all the answers. They won't have all the answers to your problem, because people's problems are very nuanced, and it's not fitting you into a mold or into a box. So a therapist isn't there to say, well, this is what you should do. Well, if you knew that, you would have done it already. How come you're not? So it's not so much about saying, okay, this is what you should do. It's, well, what has kept you from doing what it is you want to do or feel like you should do? What's happening there, if that's what the situation is? So the therapist isn't about giving you the quick answers. The therapist is about helping you to help yourself, because the therapist can't do it for you. They can help you to get to a place where you feel you either have the bandwidth, the strength, the courage to take whatever action you need to take. Or the therapist can help you with anxiety, with skills, with thought patterns, with how you're thinking about yourself, how you're thinking about anxiety. Or they can help you get to what's underneath the anxiety, along with the skills, and work through whatever experiences are underneath that anxiety that create anxiety when you are in present day situations. So again, it depends on what your goals are, but the therapist isn't there to just say, okay, this is what you do, and end of it. And so sometimes we do say, well, why don't you do this? But usually not in the beginning. Usually once we get to know you and we know you well, we may say something like that. But it's always a bridge to a larger, broader conversation, not like, okay, do this and rubber stamp it and that's it. It's kind of dropping a little breadcrumb there and be like, okay, well, let's talk about this more. So definitely keep that in mind, right? The other thing is some of what therapists help you to do, and I mentioned a little bit, but here's some more. They want you to increase your insight and your self-awareness. They want to help you set boundaries if you're feeling like people are just not respecting the boundaries or limits that you're setting, and maybe that's a pattern that's been through your adult life and you're kind of through with it, and you want to start setting boundaries. They can help you with setting boundaries and what is behind not having been able to set boundaries, to work that through. They can help you with that. They can help you with healing emotional wounds or emotional traumas from the past. They can help you with that if they are trained to do that. They can listen and support, and sometimes it's just going into a session and be like, I just need to talk about this. Sometimes it is about venting, and the therapists are there to support, although a therapist typically is going to try over multiple sessions. If it's like multiple sessions of venting, a therapist is going to try and help you get some movement past the venting to, what kind of action can we take here, because you're in emotional pain, you're coming in and distressed, every week, what can we do? And then of course that depends on the situation. So sometimes these things take time, sometimes it could take a session to everybody, it's an individual situation, but sometimes a therapist is there just to listen and support. And we help you to look at situations from different angles. We help you to gain different perspectives to a situation you may have been in for a long time, and just you're seeing things a certain way. Well, we're here to kind of help you see things maybe a different way or a new way, or to help heal what's under the pain that's underneath, so then you can start gaining new perspectives and start gaining clarity. So that's a big role of what therapists do. And and if a therapist has special skills or training, so if there is a therapist that you want to see that is couples therapy, well, there are therapists who are specially skilled in couples therapy. There is therapists who are especially skilled in trauma therapy or therapies. There's multiple therapies to treat trauma. And sometimes not every therapy is the right fit. So if you if you've had EMDR in the past, let's say, and let's say EMDR made you feel overwhelmed, or it just didn't feel like the right fit for you, that doesn't mean you can't have trauma therapy. There's multiple therapies, and there's therapists who are trained in multiple approaches to trauma, and there are therapists that are trained in other ways to treat trauma. So there are special skills if you're looking for something specific, or if you're looking for someone who is specialized in short-term therapy or cognitive behavioral therapy, and you don't want to do the deeper work. Yeah, there are therapists that are specialized in that for sure. So you can look up different specializations and ask the therapist if you if what their training is in. If you don't already know from their website, most therapists put their training and skills and certifications on their website. But if you're not sure or it's not clear, you can absolutely ask. So always, you can keep those skills in mind to find a right fit for you. So that is it. I hope you have a very productive intake session or sessions. And I thank you so much for sticking with me through this video, and hoping that you found what you've heard very valuable. And if you did find it valuable, I would appreciate a like, subscribe, and share. And if there's a topic that you'd like for me to cover, please comment, or if you have any feedback on this video, then please comment below. And if you're interested in my menopause, perimenopause checklist to help you organize your thoughts and help you organize your symptoms and questions to ask your doctor, you can grab that in the description below. I also have an A to Z anxiety guide for women in midlife. You can grab that in the description below. And if you'd like to work with me, you can go on my website and get to me through the contact page, or I will be linking that below as well. And thank you so much for being here, and I look forward to seeing you in the next one.